I'd like to welcome you back to the show. It's a pleasure to welcome back our healthcare expert. He is Paul Secret. He's a managing partner of PCS Advisers. Employers, bottom line here, you are spending an absolute fortune on healthcare coverage for your employees, and they're not even getting the best plan. So if you want a different approach and drastic results, give Paul Secret a call at PCSadvisers.com. Paul, welcome back to the show.
Thank you for having me, Andy.
Well, one of the most wicked things about our government, and there are many, but one of the wicked tricks they play is they have some big bill, and they call it infrastructure bill. But hiding in the pages, the couple of thousand pages of this infrastructure bill, is a plan to change healthcare plans in the private sector, which has absolutely nothing to do with infrastructure. And the worst part about it, again, is who's going to read these things, who understands what they're reading, because sometimes they reference a code and this, that, and the other that the average citizen can't do it. But the bottom line is you guys have helped flush out this or drawn it to our attention. Bloomberg Law did a story on this, and tell us about what they did or what they're trying to do.
Well, there's a couple of things that are very significant, and as you pointed out, have nothing to do with infrastructure. One is changing the affordability rule. So how much can the payroll deduction that an employee contributes to their own health insurance premium, what percentage of the total can that represent? And they've moved more of that cost to the employer, which I know there's people listening and think, well, good, that's a good thing. Well, maybe not. Maybe not. We can talk through that. So that's a significant change. And then another one is that there were some states that chose not to expand Medicaid as a result or as part of the Affordable Care Act. So they said, hey, we're not going to expand Medicaid because we realize that the subsidies we would get from the federal government to cover that cost aren't permanent. And so then we would end up having to shoulder more and more of that cost over time. We have our own state programs that we feel are filling that gap already or have a different philosophy or approach to that. And so we're going to choose not to expand Medicaid. And there were 12 states that were holdout states from that. And by the way, the state's portion of Medicaid costs in every state represent one of their largest line items in terms of expenses. So it's not a small thing. It crowds out the ability for states to fund other priorities, be it education or anything else. So in this, at least what's come out of the House and headed to the Senate, they would give subsidies to individuals in those 12 states, kind of working around the state's decision not to. So kind of overruling that, which will be a very interesting thing to watch as it goes through.
Because a lot of that can sound confusing or complicated. Employers know what it means, but the rest of us, let me explain this. The purpose of Obamacare was to shift medical and health care insurance and have everybody on this kind of a Medicare type plan nationally. Now people say, well, that sounds good. Have the taxpayers subsidize our health care. Well, the bottom line is right now the taxpayers are subsidizing Social Security. The taxpayers are subsidizing offsetting the cost to the private insurance. The whole
they provide to their employees.
nationally. Now people say, well, that sounds good. Have the taxpayers subsidize our health care. Well, the bottom line is right now the taxpayers are subsidizing Social Security. The taxpayers are subsidizing Medicare. The doctors and healthcare providers are subsidizing Medicare because it pays pennies on the dollars to them. And if everybody went on a Medicare type plan, there would be no offsetting the cost to the private insurance. The whole thing collapses.
Exactly right. And that's something that the average consumer doesn't know. Even the average employer, even those employers that are running significant health plans, they're spending more on the health plan that they provide to their employees than lots of business owners will ever achieve in top-line revenue. Even these employers don't realize what you just said. The average Medicare recipient that goes to a facility, a hospital, or a Medicaid recipient that goes to a facility, if they're on a government-provided form of health care, that facility is losing money on the transaction. So they're not able to cover the cost of the quality of care that person is receiving. They would need 118, 120, 122% of what they took in from that transaction to cover the cost. So, and then, in addition to that, you consider the fact that there's a government mandate for these facilities to treat, regardless of ability to pay, someone that comes in who's unstable in an emergency situation. And I'm not here to say we shouldn't take care of people in that condition. We should. I'm here to kind of discuss the mechanics of how that impacts our overall economy and who's paying for what, and is that the right way to handle it. So you have underpayment for care from Medicaid and Medicare enrollees showing up at a facility. You have other people showing up at a facility that have to be stabilized by the law and are going to pay zero. And so then those facilities, who can they look to make up the shortfall? Employer plans.
Right. Well, and
that's where they pile on.
Unless they eliminate those altogether, which they want with a government single payer plan.
Well, then where will it be?
Then the whole thing goes, goes bankrupt.
You either ration by price or by line. And if you look at other countries that ration by line, Canada is a close by example, there's long wait times because you can't underpay and have endless supply. I mean, that's just simple economics in anything. So then wealthy Canadians that need to get a service fly here and pay and get to the front of the line because you can't just create supply if you're underfunding. I mean, it just doesn't work that way.
All right. We're going to take a break. Again, folks, if you are a business owner, you want more affordable coverage and better coverage for employees, or if you're an employee and you want that from your employer, consider PCSadvisers.com. Tell your boss about it, that you heard it on this show, PCSadvisers.com. We're going to be back with more. You're listening to the Andy Caldwell Show. Stay tuned. I'd like to welcome you back to the show. Our guest, Paul Siegert. If you want different approach with drastic results to managing healthcare, if you're an employer, please consider discussing your company's needs with PCS Advisors. He's one of the nation's experts on how to address the unsustainable cost for employee healthcare while finding a better way. Paul, welcome back to the show.
Thank you.
So I have a friend whom I won't name. Early on, I mean, he surprised me. Early on, he pulled out his fake vaccination card. So, some people don't think that's funny. I just was shocked at how quick he got one and how good it looked. How many people, there's a survey out, how many people are willing to lie that they've gotten vaccinated if it means keeping their job or being able to go to their gym or their favorite restaurant?
We're like 1 in 3 on this one. I mean, it's pretty incredible. But when you create an environment where you put people in a position where, and especially with the lack of trust, I think that we have in this whole topic. I mean, you have, Norway, if you've had COVID and you're under the age of 18, they're not going to give you a vaccine because they know that's ridiculous. Because natural immunity is real. And so we put people in a corner here where some of them are going to have to decide, do I keep my job or do I get vaccinated even though I don't believe I need it and I don't want to, or do I sign an attestation form saying I did even though I didn't, or get a card that's not legitimate. I think recent survey, it's 28% that said they would do that. And it's low single digits percentage of people that said an executive order requiring it, which would be tough to accomplish in this country, or a corporate policy saying vaccine or fired would change their position. I think we're down to the holdouts now, and the carrot didn't work. The stick isn't really working. So, we're just going to see where the chips fall.
Do you know what the penalties are for having a fake vaccine card? I guess it depends on where you used it. Like if you wanted to go to a restaurant or a gym in some places.
Yeah, it's a quagmire too for employers, because they're going to have, again, we're loading employers up with more. They're kind of the policemen for the state in this matter, and they have to be extremely careful in the way that they navigate through this, not only in implementing the mandate, which may or may not hold up in court. Currently, it's not looking strong. But then again, 6 of the 9 last times that OSHA did a emergency deal like this, they didn't hold up under court scrutiny. But suppose it does. Not only do they have to manage that, now they have to manage, how do we deal with infractions in a way that doesn't open us to employment lawsuits? I mean, it's a big mess.
So last time we talked about this, we got about 7 minutes. I raised the issue of a program called HIPAA, where an employer isn't really supposed to be able to ask personal health questions, including presumptively, have you been vaccinated? Have you had COVID? Sure. What underlying conditions do you have? Could you talk about that? You have about six minutes.
Sure.
Tell
Absolutely. I think COVID has become the original intent of the rule was that you would safeguard people's health information and not use it against them. You wouldn't use it, for example, if you knew you had someone with a very expensive condition on your health plan, you wouldn't use that knowledge to fire them. You wouldn't inappropriately share that information with other people. And that's really, in real simple terms, it's about safeguarding information. And yet, when we look at part of the problem we have, we're arguing about the wrong things in healthcare, I think, in general. We're arguing about, should the government pay more? Should the individual pay more? How about we work together and say, it's not right that employer plans are shouldering the cost for the system, especially when the system is loaded with waste. Let's fix that. Let's get transparency into the system. Let's get pricing in line with the actual cost of care plus a reasonable amount of profit and deal from that standpoint. And I'll tell you who's used, and this is kind of, I think, the root of the comment that I made on the last time we were together, was HIPAA was intended to protect individuals' privacy around their health. And it's become the biggest red herring for insurers in some states, and I would even say a majority of states, because each state, when it comes to insurance, is kind of like its own country, which is foolishness. But it's allowed these states to use this rule, the insurance companies in these states, to use this rule as a way to withhold information from employers. And it's a complete red herring. So you have an employer in California, as an example, that's frustrated, which would be the majority of employers, with the inflationary nature of the cost of healthcare for their employees. And if you're an employee listening, you should be outraged as well. When an employee, when it starts to cost, what it did this year, more than $22,000 to provide not very great coverage to a family, the employer can't afford to increase your wages as much because they have to spend it on health insurance premium. And when that employer is frustrated and goes to the insurer and says, what the heck is going on here? I need a P&L on my plan. I need to know how much, compared to the amount of premium that I sent you, what did you spend? I need an accounting of what's going on. And then in California, which everyone thinks is an extremely liberal state, out to protect the consumer, actually, when you look at the way the insurance business runs in California and many other states, I'm not picking on California, just California, that employer who could spend millions of dollars providing health care to those employees will not get a transparent answer from an insurer. They're going to use HIPAA as an excuse to not provide a P&L on the plan. They're going to use HIPAA and say, oh, sorry, we don't track that information. Because of HIPAA, we cannot share it with you. And if an employer really wanted to have a little bit of fun with this, I would say spend the $20 or $30, which is all it costs to get HIPAA certified, saying that you too will safeguard the information. Because, by the way, according to ERISA, that employer is the most responsible person for that information and has a bigger right to it than the insurer. The insurer, they're an outsourced player in this whole thing. So just like they have to safeguard your funds in a 401k and really be a fiduciary, same is true for this health plan. And so go, CFO, go spend $30, get HIPAA certified, and then go back to the insurer and say, well, I'm HIPAA certified, so go ahead and release it to me now, and see what their response is then. Because it's frankly a comedy show in business. They're just going to but up. And then we see them, we suggest this to employers every week. And then the insurer comes back and says, well, we'll release it, but we're going to need to charge you a fee to release this data. And now HIPAA's out the window. They don't even mention that anymore. Now they want $5,000 or whatever the number is to release this data, which tells an employer they're on the right track. I've had many employers say, I must be on the right track because they're fighting really hard to give me this information. Because when they reveal it, it shows they are not being treated fairly. And to me, it's the biggest, most disgusting travesty of what's going on in our economy right now. The fact that we allow a fifth of our economy to essentially self-regulate, and the private sector ends up funding the shortfall of all these other programs that are still underfunded despite that. I mean, it's an incredible, incredible situation that we've created.
Well, I want to thank you for that. I've been wondering about that for a long time, why this is working the way or not working. I'll tell you the other thing that killed me early on when Obamacare, California, and my day job is a government watchdog. So Santa Barbara County signed up everybody and their mother for Obamacare, even though it was going to cost them money down the road. They couldn't wait. They used the probation. Somebody went into their probation officer, and the PO signed them up for Obamacare, social services, mental health, alcohol services, probation services. You walked into a county office, they signed up between 20 to 30,000 people for Obamacare. It was insane how much they were all in, all chips in. And of course, the taxpayers are going to end up paying for that. Hey, we're out of time. Paul, thank you for being our healthcare expert, and have a happy Thanksgiving.
Thanks. You too. All
right. We're going to be back again, folks. Go to PCSadvisers.com, PCSadvisers.com to save lots of bucks and get your plans back. We'll be back. Stay tuned.